Welcome everyone to our second presentation. And we want to thank everyone for attending the personal challenges. This council that set up this presentation is comprised of local senior organizations. We have Alden Poplar Creek, Brookdale, Cedar Village, Comfort Keepers, Friendship Village, Kenneth Young Center, Home for Life, Revere Court of South Barrington, Schaumburg Fire Department, the Nursing Department, the Police Department. We have the Senior Barn, I think Marina's back there somewhere, the Township, and of course the Township Library. So we want to thank the council members for getting this together. We'd also like to thank our presenters. We have Lori Gibson from Home for Life, Mike McGinn from Comfort Keepers, Julie Gilpin from Brookdale, Marcia Dunning from Alden Poplar Creek, and Eileen, I hope I pronounced your last name correctly, Skberky? So sorry. From Revere Court of South Barrington. So we want to thank them. We also want to thank the library for hosting the event. From the Village of Schaumburg, we have Carla, who is recording this presentation. And we also want to thank our Citizen Police Alumni Association. Those are the volunteers in the back who are here all the time. So the setup for the presentation will last approximately 30 minutes. Followed by 30 minutes for questions. So if you have a question, I'm going to come around with my microphone. I will try to repeat the question if I can. And if you do not get your question asked within that 30 minutes, our presenters have offered to stay after for 15, 20 minutes so you can ask them questions one-on-one, okay? If you have not yet signed up for our May presentation, we're going to have a fashion show I believe on the 24th of May. You can contact the library and get your spot reserved, okay? So without further ado, I'm going to have Lori come up and start our presentation.
Good morning. Thanks so much for being here. We're so excited. We work together with a continuum of care, and just to have resources for you, kind of educate you on what questions you may have on aging in place all the way through to senior facilities. So some of these slides, you're gonna say, okay, Laura, stop showing us grab bars, but I do have to really push that a little bit, so bear with me. This is the presentation, is preparing for challenges, and we're really here to guide you, give you resources, find out what we can do to help, and again, we're looking at maintaining your independence, healthy living, no matter what your situation is. So I'm going to tell you a little bit about certified aging in place and what aging in place is, based on a program the National Association of Home Builders and ARP came up with, and it's a program to certify builders and occupational therapists so that they know what to look for in a home and help find some barriers and find solutions for you. So 90% of older Americans 50 plus want to stay in their current homes for the rest of their lives, but most homes are not designed to accommodate them. That's why they started figuring out what we can do to modify or build homes to make them more accessible so that you can age in place. And the U.S. Center for Disease Control and Prevention defines aging in place as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. Again, we want to really focus on everybody has a different situation, or maybe your family member or your neighbor, you see them struggling. So what is aging in place? Remaining in your home during the aging process or with a disability, or modifying your home so it's accessible, adaptable, and safe. And what it isn't is refusing assistance, struggling, and living in an environment that actually could cause injury, or is not safe for you. And we all hate to hear this and the preaching of it, but There's some really good simple fixes to help you navigate and maintain your independence so that you can keep coming to these great programs. I know these are scary statistics. I'm just going to put them up there. You can read them. But the bottom line is the CDC reports that, falls happen. 1 in 4 over 65 has a fall, and some very serious consequences from that. So we're really dedicated on doing outreach to prevent a fall. What kind of supports, what kind of equipment can we put in place to make sure that we're being able to navigate our home safely. And home modifications, per the CDC, can prevent 30 to 50% of these accidents, including falls. So sometimes it's just a simple fix that I'll be showing you later on, and it can make all the difference. So who can help us age in place? Again, I mentioned certified aging in place specialists. So when you're a certified aging in place specialist, you are really trained to look into the home, find the barrier. Every quarter inch is a tripping hazard. You have to look through your home. In your bags, I put in kind of a home checklist for yourself to kind of go through your home and maybe identify things that could be, a challenge for you. And Universal Design License Contractor also can modify or give you solutions for any age. They're just amazing with learning how to adapt a home and let you age in place there. So a few of these pictures that I wanted to go through. You're elevating your entrance. So you can come up with something as elaborate as working the ramp into your landscaping, or a garage ramp, or these little threshold ramps that help make your tripping hazards from your thresholds, eliminate those. So there's always a solution. Indoor, outdoor stair lifts. As you can see, there's a way we look at it. Quickly, a ramp has to be, for every 1 inch of rise, has to be a foot out. So if you have 4 or 5 steps, you're looking at 35 plus ramp. So that's just a quick guideline. We look at showers. How are we getting in and out of our bathroom? How are we toileting? There's some really great solutions to give you more room in the toilet. As you even see the bottom left, it's a wall-hung toilet. And that will gain you about 8 to 10 more inches in the bathroom if you're in a walker or wheelchair. You could see the one with the pop-up grab bars that will mimic a commode. So these are just all real good examples. The suction cup grab bars, it's what we're going to really talk about. Every one of them has 1 or 2 labels that they're very dangerous. They do not bear weight. They are not intended to be a grab bar. So I always make a point of showing you that do not buy those or use them. Put in a good ADA compliant grab bar. So right now I'm going to quickly show you just some new innovations, and then we'll move on.
Alexa, turn on kitchen.
Echo, what's on my shopping list?
You have 3 items on your shopping list.
Alexa, call Sanford and Susan.
Calling Susan.
Alexa, turn on bedroom lights.
Okay.
Echo, call Grandpa.
Calling Grandpa.
Alexa, tell me a dog fact.
A 1-year-old dog is as mature, physically, as a 15-year-old human.
Alexa, what am I holding?
It looks like Tea Forte World of Teas.
Alexa, tell Dagmar it's time.
You want to go for a ride?
Alexa, trigger door open.
So many great innovations. It's a game changer for so many people. So we talked about home modifications. Now we're going to bring Mike up with Comfort Keepers, and he's going to talk all about the support you need at home with home care. Thanks, Mike.
Thank you, everyone, for allowing us to be here today. I really appreciate it. One of the key things here is that Lori has your house all ready to go. She's got all the modifications in place. But what's next from there? You have to have someone to help you in the home. And that's where companies like Comfort Keepers come into play, the home care agencies and the home health agencies. I'm going to focus mostly on the home care, but tell you a little bit about the differences between the two, because there always seems to be a little bit of confusion. We often get folks that say, well, I have home health, I don't need anything else. But in reality, you need both a lot of times. Home care agencies are non-medical. I know it says non-skilled, but caregivers are skilled. They do have training, and it's required by the state that they are trained for the activities that they do. They're just not certified as an RN might be, or a physical therapist or an occupational therapist would be. Our caregivers come out for hours at a time. Home health folks come out for maybe an hour at a time or less. We are licensed by the state. There's lots of rules and regulations that home care agencies have to follow, and they're all intended to protect the customer, to make sure they're getting what they signed up for in a safe way. We have here some of the things that we do, but what the state requires of us is that all the caregivers are our employees. They're all vetted, so they have good background, solid background checks done. We check their driving records as well. They're all bonded and insured. So if anything goes wrong in the home, the agency is liable for that caregiver. And that's really important to know, because when we talk about caregiving, the biggest pushback we get is, I have a friend who has a friend who knew someone who did caregiving, and they hire them privately. You don't get any of that with that. So as a licensed agency, background checks, ongoing supervision of the caregiver, licensed, bonded, and trained. Very important. In terms of what we do, it's what we all do in our homes every day. Cooking, cleaning, laundering, running errands, shopping, social companionship, even social stimulation, brain games, things like that to stimulate our clients. We're just coming out of the winter, where the biggest problem we have with seniors is isolation. The weather's crummy, they don't want to go out, they're afraid to go out with ice and snow and things like that. But then we also can help in the bathroom with more hands-on care, helping someone in and out of the tub or the shower safely, helping with body wash, hair wash, nail care, oral care, shaving, overall toileting assistance. As we're aging, we have issues with incontinence. We can do something as simple as helping someone on and off the toilet, the full incontinence care. Okay? A lot of our folks are having some unsteadiness in their gait, so they use walkers or canes. Our caregivers are trained in how to properly walk with someone as they're ambulating throughout the home, so that they can live safely after Lori's made all of her modifications. Okay. Other questions that we get along these lines are, I don't need a lot of help. I just need this for a couple of months till I get through this procedure I just had, maybe a knee replacement, a hip replacement. You can go anywhere from 4 hours a visit to 24-hour round-the-clock care. It just depends on what you require. We come out and do an assessment to determine what all those needs are and to determine what a typical routine is for that person on any given day. Okay? How do you pay for it? That's the biggest problem we have, is the pushback is, how am I going to pay for this? I can't afford it. A lot of it is private pay, but there also are other options like long-term care insurance. There are veteran benefits that are available not only for the veteran, but also for surviving spouses. There's also community-based benefits, as well as if someone is depleting their resources entirely, there are Medicaid programs that are available. From a skilled home health standpoint, the big differences are these are degreed individuals that have very skilled medical degrees that allow them to perform the different things that they do. Nurse might come out on once a week. Physical therapy might come out 2 to 3 days a week. Occupational, the same thing. Speech, depending on the illness. Paying for home health is a little bit different because it is medical. Medicare typically will pay for it up to a limit. Everyone has their own limits. They do their own assessment to determine how much care you should need. A lot of it's based on your progress. How well are you doing with the physical therapy and the occupational therapy and things like that? If you stop making improvements, they're going to stop the coverage. Okay. Now, I'm already getting my sign that my time is up, so I know we're going to have some time for questions later. I sped through that. Very happy to answer any questions you might have at the end of the program. So thank you very much for your time. And now we'd like to introduce Julie, and she'll talk to you a little bit about Brookdale.
Hello, everybody. It's good to see everybody's faces. I think it's switched. I know there's a lot of questions with independent living and assisted living. That's what I'm here to talk about. Again, I'm Julie from Brookdale. So I'm going to try to answer some of them, but afterwards, of course, feel free to ask any questions. Independent living, I'm going to start with. That is truly like living in your own home. So however you feel in your apartment or your home right now, that's the feeling of an independent living. But it is more of a feeling of community because you have your dining, you have your activities and events included. Most communities have housekeeping and maintenance and security. So I truly say it always is a very big sense of community. It's when you really want to give up some of the worries about maintaining your own home. But if you choose to go on vacation, you can have your car there. It really is independent living. There's a lot of activities. You're dining, usually 1 to 2 meals a day. It depends on the community that you're looking at. And as far as cost goes, it depends. Some are buy-ins and some are rentals, usually with a year lease, just as if you were living in an apartment. There may be a one-time community fee. It depends on the community that you're looking into. It's designed to help you age in place. So we can also support caregiving in buildings. So if you needed a little extra assistance, you can bring in a caregiver. But also many communities will have therapies, outpatient or home health in the buildings that can support you also, as well as in-house doctors that may have a clinic there. Assisted living, on the other hand, is a little bit higher level of need. This is when you need more nursing support for med management or disease management, for example, with diabetes, or maybe even just incontinence. It's around-the-clock care. The amount of hours a nurse is there depends on the community that you're in, but there's 3 meals a day, housekeeping, maintenance, laundry, it's all included, utilities. And this is where you're going to get help with bathing and dressing. And again, routine wellness checks, because you are going to have a nurse there. They're going to keep a closer eye on you. Usually with this, you get an assessment prior to see what sort of skills and level of needs you have. All activities and programs in some communities, you can also join the independent living residents in their dining room or their activities. And as far as pricing goes with assisted living, it's a little bit more than independent living. Again, it does depend on the community. Some do a nursing assessment and it's done by need with your meds. Some may be just a set fee for different levels. Those are good questions to ask when you are interviewing them. All are private pay. With assisted living, if you do have long-term care insurance, some of the policies will cover a portion of it. I have my cheat sheet here. I think I covered pretty much everything. I'll open it up to questions at the end. So I want to thank you, and I'm going to pass it over to Marcia.
Good morning, everyone. My name is Marcia Dunning. I'm from Alden, Poplar Creek, and Hoffman Estates, and I am going to be speaking this morning about SNFs. So first, what is a SNF? SNF stands for Skilled Nursing Facility. We're inpatient rehab and treatment center that are staffed by medical professionals. So medical professionals are our nurses, our nurse practitioners, our NPs, our PAs, our physician assistants, our doctors. In skilled nursing, we have physical therapy, occupational therapy, and speech therapy for the rehab component. But what do we provide there? We provide medical necessary services for people. So people that may have gone to the hospital and had major surgery, let's say a hip fracture or something, and they can't go home right after the hospital. Because with the hospital stay, it's pretty in and out these days with hospital stay. So you could be in and out in 3 days with a major total hip surgery. So with the hip surgery, they do obviously therapy in the hospital, but most people do post-acute care over at a skilled nursing facility where we have the aggressive therapy. So the therapies in a skilled nursing generally is 2 hours a day, 6 days a week of aggressive, intense therapy. Something you're not going to normally get at a hospital, in the hospital setting. So a lot of people maybe are living alone or have an elderly spouse that aren't able to take care of them. That's when SNFs come into play. So we do physical therapy there as well as long-term care. So we will accept people in that are aging and maybe need the assistance with bathing and dressing and eating and showering, all things like that. So that's another component of skilled nursing. What services, or how is the care paid for? There's a lot of ways that you can go into skilled nursing, and it could be a private pay situation. If you're doing post-acute care with rehab, you have Medicare, private insurance pays for that. There are Medicare guidelines. For instance, just an example, if you're in the hospital and again having back surgery and you have Medicare, Medicare will pay for the first 20 days at 100%. Your co-insurance will pay for the other 20, about approximately 20%. So that's how Medicare works. We also work with commercial insurance on that, and that will pay for you as well. But again, that's another guideline with insurance. Basically, we submit your progress each week, and then the insurance kind of dictates your stay there. But all of these skilled nursing facilities are advocates for you, so they will always work for you. So if you feel that you are not able to get home right away, we'll work with you, and we'll work with insurance companies in trying to advocate more time for you. What happens if your money runs out? This is a big thing. Once, say you go in with private pay, insurance cuts off, Medicare cuts off, now what do you do? You can always transition into long-term care. If you transition into long-term care, we would have you apply for public aid. Not all skilled nursing facilities take public aid, but there are a good many that do. One of the tips I always tell our families, because they're out there looking for skilled nursing facilities, and one of the questions that they're going to ask you in the interview is if you, or you might ask, do you take public aid? Because once your private funds run out, what do you do? So if they answer, yes, we take public aid, take it a step further. Ask if you take public aid pending. And that's really important. I get so many families come back to me and say, I was at another skilled nursing and they said they took public aid, but they don't take public aid pending. So that's a real big advice. If you take anything from this, ask that question when you're out looking for skilled nursing. The other thing is just, I'm running low on time here, as far as in search for skilled nursing, one of the things you want to ask, obviously, is about the public aid pending. Take tours of several different facilities. See what you like. If you like it, most likely your family member is going to like that as well. And then be sure to ask a lot of questions. It's always very important to ask away as many questions as you can, because you want to make sure that is the right place for you. Okay, thank you very much. I'm going to introduce Eileen. I'm from Revere Courts.
Good morning, everybody. Again, I'm Eileen from Revere Court. We're a memory care community in South Barrington. So we kind of like bridged into independent assisted living and SNFs. Kind of memory care is kind of the tail end. You have a couple of options with memory care. You have standalone memory care that all they do is specialize in memory care, or you have ones that have independent assisted living, and then they have a memory care combined within their facility. And basically, we provide, all memory cares provide a safe and secure environment for your loved ones. Those who do have memory care, cognitive changes, anyone with Alzheimer's or dementia, those are the individuals that will be, joining a community that specializes in memory care. Services that we provide, it's such a wide range. You are provided with nursing care 24/7. You have caregivers, certified nurses aides to take care of your loved ones, to take care of their activities of daily living. So everything from assisting to getting dressed in the morning, to bathing, to assistance with eating, activities throughout the day. That's that social engagement that is very important for individuals with memory care, to keep them stimulated and to keep their life purposeful, and definitely give them the best journey that you can give them during this difficult time. We have physicians that come on site, physical therapy, occupational therapy, speech therapies, podiatry, dentist, vision, so everything can come to that community without having to take anybody out. Yes, it's great to get them out if they can, but when they reach a point in their journey that they're not really able to be that mobile or go anywhere, the services can come to them. We also have salon services, so they can get nails, guys can get manicures and things like that, and it does happen, the gentlemen do love their manicures as well. For pay, most memory care communities are private pay. I hate to say it, there's very few that are not a private pay. Something that we would love to see in the future for Medicaid to start assisting. Unfortunately, that is not happening at a fast rate that we would like to see. So a lot of the funds are private pay or through long-term care or veterans assistance. We do assist when the time comes where funds might be running low. We do assist our families with that transition and pointing them in the direction of where to go for Medicaid, or try to assist with finding them communities that can accommodate their financial benefits. There's a lot of benefits. You're giving your loved ones a chance to maintain their independence, individualized care, special services. We're going to help them with medication management and mobility, and we're going to provide physical and a secure, safe environment. So I'm getting my little 3-minute wave, but I will be around for any questions if you guys have anything, but we're all here with just giving you a map to, come along with, okay? All right, thank you.
So can we thank our presenters for the valuable information? So I'm going to grab a microphone. If anybody has a question, if you could just raise your hand, I will run out and get it answered. This lady had a question on Meals on Wheels. Is the programs in DuPage County similar to Cook County? Does anybody have any information on that?
Gosh, I would look at your local agency, because I know they're all different. For instance, my mom lives in Western Springs, and we were looking for that. And Age Guide, Aging Care Connections, one's in DuPage, one is in Cook. They have different services, so I would just contact your local kind of Age Guide agency. I can give you some recommendations. Kenneth Young.
What does public aid pending mean?
Good question, and I'm sorry I didn't cover all that. When I was talking earlier about skilled nursing, when I've had families come to me and say they've asked that question, do you take public aid once my money runs out? And these agencies say, yes, I do. That means when they have active public aid. Public aid pending means when you're between, so you're running out of private funds and you need to apply for public aid. So you're the in-between, you don't actually have active public aid. But a lot of these SNF facilities do have public aid specialists right there in the building, so they can walk you through the whole process.
She's asking if there is a list of different facilities available.
I work for Alden, so I can give you the Alden list of all the facilities.
Okay.
Hi, everyone. I just wanted to respond to that question about the list. I'm part of the Committee on Aging, and we put out a whole senior resource directory that has an outline of all the skilled and assisted and independent living sources in the Schaumburg-Hoffman area. We have books available at the nursing division, at the barn, some over at Village Hall, and it's also available online that you can easily access it on the Village of Schaumburg website. So it's this booklet, and we actually just did updates on it to based on any changes.
Thank you so much, Marina. Does anybody have a question here? Right, so this person is asking about skilled nursing. When they ask for financial information, what kind of information are they looking for? Are they looking to whether to approve or deny based on financial status? How far back do they look? So are they looking for a certain amount and how far back?
Basically, when they're asking to know what your financial status is because we need to look at how much, we give you the cost of what a year would be, and they're trying to see if you are able to pay that. Or do we need to apply for public aid right away? And I think, again, there are certain facilities that actually will take public aid pending, and then that's what they're kind of looking at, to see if you could pay for that particular amount, or if you can't, then maybe this wouldn't be a facility for you, because some of them are just looking, I know that there's facilities out there that will ask for like a two year usually. Mm-hmm.
Right, so she was asking questions about financial questions, how far back they look, how much are they looking for, and why are they looking for the amount that the person has, their assets, their financial information, okay? So yes, so she's asking if you're married, do they look at a joint account? If one of the persons needs to go into a facility, do they look at a joint account? And do they look at for the year? And this might be something too you might want to ask because it's very personal. So it might be something you might want to ask after the Q&A because I think that might be a little bit more appropriate for you, and you'll get the answers you want. Okay. Does anybody else have a question? So the question is, who could a person contact to have them do an assessment on their home to see how safe it is, maybe offer some recommendations? I think the nursing division does that. Am I correct?
They do.
Or fire department does that as well. Go ahead, Mike.
As part of our assessment, we're primarily focused on the individual person themselves, but we also do a home assessment. And we do offer up different suggestions that might make things easier in terms of maneuvering, equipment, and things like that. But I think Lori also would do a more in-depth one in terms of home modifications and things like that, but I'll let you respond to that.
Well, and it could be just something, you're struggling getting over a lip in the shower. So yeah. So we would do a whole home assessment if somebody wanted it and give you recommendations. And if you decide, I just want to put a grab bar in my shower to get in and out, that's wonderful because it really makes a big difference. But yes, we do free home assessments. An occupational therapist, we train occupational therapists and they're great and that's covered with Medicare if you have a situation where maybe you're coming out of rehab, they'll do an assessment, and then often they call us to confirm what their, the barriers are and how to correct that. Okay. Oh, and by the way, you guys, I put a free home checklist in your bag, so you can kind of go through your home and just see. Sometimes, it just makes you more aware. So.
Right, so that's a great comment, because before you leave, we do have giveaway bags, which have all of their contact information and some brochures. So it might be a matter of just looking in your bag, and you might be able to get your questions answered as well. So there's some really good resources in your bag.
Yeah.
Okay. Somebody else? Oh, yeah. Oh, so this person was asking about the rampy thing.
This is a threshold ramp. Okay, so this is just a piece of it, and they cut it from a 1/4 inch all the way to this. This is the biggest thickness. So like your patio doors, they cut it to measure. So we could order them for you. You can find these online, and they're called threshold ramps. This is made out of recycled tires, so it's real heavy duty, so it won't slip if you put it on both sides of that tripping hazard. So you know how patio doors have almost an inch and a half, if not more? They can cut it to that so it's a smooth transition over that. So there's lose that tripping hazard. And these are really great, honestly, and it's not a very expensive way to keep you safer on those thresholds.
Right, so take a look at these after the presentation. Feel free to come up and you can take a look at the different items up at the front.
Yeah, after, come see me, because there's some cool stuff. Like this hinge right here it's called an offset hinge. And if somebody's going into a bathroom sideways because they can't come straight in with a walker, that's a very big tripping hazard. This hinge alone will take the door out of the doorway and gain you almost 2 inches coming in. So some people, you know, in a wheelchair, they might just be like, oh, I just need that little bit. It tucks the door out of the doorway, and it's a simple fix. You know,
So feel free to come after the presentation and take a look. Does anybody else have a question? So she was asking, like, if it's a married couple, can one stay on Medicare and the other person transition to Medicaid in order to be able to go to a skilled facility or whatever facility is warranted? How does that work?
I know it's private pay in the beginning.
Right, it is private pay in the beginning. There are guidelines. I can actually connect you with someone, but it is possible for you to stay on Medicare and then your spouse to be on public aid pending. So I can
And I wonder how much money they're looking at under private pay requirement, like 1 or 2 years.
So Loretta, how about after the presentation? I think Marcia would be really good, good resource, right?
You're going to be my contact.
There we go.
Brace yourself.
Does somebody else have a question? Right, so this gentleman is asking about when do you determine whether you can you keep your maybe a family member at home versus putting them into some type of facility? And then what kind of questions would be the best to ask a facility about their family member?
I'll take the first half of this, okay? In determining whether someone should stay home or go to a facility, sometimes it's an emotional choice, you know, in terms of the person just wants to stay at home. They don't want to go anywhere else. They've been in the house for 50 years and don't want to change the neighborhood, and that kind of thing. We feel we can provide coverage for someone to stay in their home with caregivers. Sometimes it's expensive. If you have someone there 24 hours a day providing 24-hour care, then it becomes an economical choice. You have to decide, do you overrule the desire to stay home based on the cost differences? Early on, if care is, like, let's say, minimal, it would be cheaper to stay at home, potentially. If the care gets to the point where it is 24 hours a day, 7 days a week, the costs become very comparable with facility care. That make sense?
And the questions might actually be more of a one-on-one, I'm thinking, is that right?
I think so. I think what you're asking too, and correct me if I'm wrong, is that when I was saying ask questions, one of the things was the big thing was the public aid thing, public aid pending, because they can just tell you yes, public aid, but then you're at the point that they say, well, we don't accept public aid pending and you don't have active public aid, so now you have to move your loved one. So the biggest thing is aging in place, kind of like what Mike was saying. You can age in place at some skilled nursing facilities and others you can't. So that's why it's a major question to ask. Because you're at the 2-hour mark and you've got to get your loved one out of there and you didn't know that. So now you're searching for a place. So that's one big question. Other questions, I can go over with you afterwards too.
And I think this is a question that a lot of people are asking, financial, you know, I mean, of course at emotional level, and I think we all probably have experienced it, and people that are not even here. But it does come where financial does become a major, a major importance on, you know, where you can put your family member or loved one, or how you can take care of them properly. So I do highly recommend, if you guys have questions, make sure, if they don't get answered through the Q&A right now, make sure you ask these questions, or if you have to go, make sure you get that bag, because it does have the contact information for people. And although all the presenters work in a private facility, so they're private companies, they are awesome. They are awesome resources. It's not where it's competitive. They are wanting to help people get into the right facility, the right care, and try to do it, with your financial need. I highly recommend them. They are awesome people, and they really are the number ones to help people get their loved ones into a really good place. So take advantage of their information and their knowledge. You probably have time for one or two more questions. So she was just reminding, I don't know if you guys were here for the March, last month's presentation. We did have the fire department and the nursing division, and you're absolutely right. The fire department does request that if you have any medical, you're taking certain medications, you have different medical issues, that you put that information on the refrigerator. If they're called out, fire department, police, their go-to place is the refrigerator. That's where they look for what kind of medications you're taking, what kind of medical history you have. So please make sure that you put that information on your refrigerator so that if they should be contacted, that they have all of your information. And then the final comment was, our nursing division was here. Marina is part of senior services, which is part of the nursing division. They do have equipment that they do loan out. So if there is some kind of equipment that you do need, maybe it's temporary, you had surgery, contact our nursing division. They are awesome. And they have some really good equipment, and they have some really good knowledgeable nurses on staff. So it is a good resource that Schaumburg does offer. So I think I have time for another question or two. Correct. So she had mentioned that there is a paper with a magnet that you can put on your refrigerator. Marina, do they have those at the nursing division? Yes. So if you don't have a magnet that can list your medications and your medical conditions, you can contact the nursing division. I think even the fire department has it, but I would contact the nursing division if you would like to have one of those. So the nursing division, the question is, where is the nursing division? The nursing division is located on the corner of Plum Grove Road and Schaumburg Road. So it is on I have to get my directions. So it is on the northwest corner of Schaumburg Road and Plum Grove. Am I right? By Maxwell's. Does everybody know where Maxwell's is? Okay. Well, I did not know that. Okay, we have time for one more question. Anybody have a question? Oh, one more.
Yes, we provide hourly and live-in service, yes.
Is the live-in more cost-effective?
It's really more to it than that, because with live-ins, even though they're there 24 hours a day, the labor laws require that they get 6 to 8 hours when they're up to sleep at night.
Absolutely.
So if a client is sleeping through the night and does not need any assistance, it would be more economical to have a live-in than have 24-hour care.
That's what I'm thinking.
So if you have any caregiver, having a caregiver come in, comfort keepers can answer any questions that you have regarding that. So does anybody have a final question?
Paula, if I could just make one point. I know this question often comes to me, and it's really about your situation now, where you're living. If you're in a home, a condo, a townhouse, an apartment, some people don't think that they can put in a comfort height toilet or a grab bar because they're in a rental. But that's not true. The Fair Housing Act protects you with that. So you can, and we counsel your landlord and say, they don't have to pay for it, but that this tenant should be able to make reasonable accommodations for themselves. And I have a lot of examples of that. So it's just, if that's your situation, just know that you are protected by that.
All right, you guys, thank you guys so much for attending our presentation. Hope you enjoyed the information. Again, our presenters will be here. Did everybody hear the question?